This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice, featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today on the program, we're speaking with Mr. John Sebastian, the CEO of Carousel, one of the largest and fastest growing healthcare staffing and workforce management solutions in the U.S. Mr. Sebastian joins us today to discuss the important balance of keeping up with the digital trends, continuing to provide a personalized career experience, and ensuring we are contributing to an ethical and sustainable workforce in healthcare. And Mr. Sebastian, thanks for joining us here today.
Eric, thank you for having me.
You're more than welcome and great to have you on the program. So for starters, if you would, tell us a little bit about Health Carousel and the types of challenges the company offers solutions for.
Sure. Health Carousel, at Health Carousel, our vision is to improve lives and make healthcare work better. And we do that through our mission of ensuring that every patient has a healthcare professional when and where they need it. So what we do is we help to solve critical shortages in healthcare professionals, especially nurses at hospitals across the country. We do this by helping to place nurses from international locations and domestically in hospital clients where there are nurses shortages and the patients need them.
Just what little you have mentioned here today, I'm already appreciating what you do there at Health Carousel and looking forward to hearing more. Now, your company's higher purpose is improving lives and making healthcare work better. Explain a little more about that and why it's so meaningful to you personally.
Yeah, sure. That's actually, while companies typically measure themselves based on things like revenue or volume or profit, and certainly we look at those things. The first way that we measure our company is through patient lives impacted. That's because all of the healthcare professionals that we're placing in hospitals across the country are interacting directly with patients, and those are our loved ones. So I'm proud to share that this year we surpassed, since our founding, that we've improved the lives of over 10 million patients through the healthcare professionals that we've placed. And that higher purpose really ensures that while, of course, we have a business to run and we're focused on growing that business and making an impact, that at the end of the day, the reason that we exist is to make sure that patients get the health care that they need. And this also ensures that as we think about placing nurses at hospitals across the country, we do it with thinking about our loved ones in mind to make sure we're placing qualified healthcare professionals that are a good match for the environment in which they're being placed.
Now, another question for you, Mr. Sebastian. What trends are you starting to see right now, and how do Health Carousel's offerings stand out in the crowd?
Well, the last couple years has really changed the environment. As you can imagine, during the pandemic, when there were severe shortages of nurses at hospitals throughout the country, it really was a clarion call to our organization to step up and deliver on behalf of our clients. So we've spent the last couple of years really working even harder than ever to help close some of the gaps that our hospital partners have in nursing shortages. But I'll tell you that it's really an acceleration of a longer term trend. Just this year, the first baby boomers turn 70. And we know that after the age of 70, people's healthcare needs go up fourfold. At the same time, actually, many healthcare professionals are disproportionately baby boomers themselves. So what this means is over the next 20 years, there's actually going to be an increase in the medical needs of our population at the same time that there's going to be a decrease in the amount of healthcare professionals that are available to take care of those patients. And so, what Health Carousel offers is solutions to help meet that need and deliver against our mission to make sure that every patient has access to a healthcare professional when and where they're needed. Our focus on the higher purpose of improving lives and really connecting to the mission is really something that differentiates Health Carousel in the market as an organization that's focused ultimately on improving lives and make healthcare work better.
Again, we certainly appreciate all you're doing in the space and for joining us on behalf of Health Carousel. Today we're speaking with John Sebastian, the CEO of Health Carousel, one of the largest and fastest growing healthcare staffing and workforce management solutions in the U.S. here on eHealth Radio's Healthcare and Health News channels, a part of the eHealth Radio Network. Now, continuing on, also Health Carousel was recently recertified by the Alliance for Ethical International Recruitment Practices. That certainly is impressive. Can you talk a little bit about what that means for the company and the industry?
Yeah, our company is committed to the ethical recruitment of healthcare professionals. And this matters everywhere, but it especially matters internationally, where many of the nurses that are coming from overseas to the United States, this is the first time they've even been to the United States. And it's difficult for them to be able to ascertain who are the partners that they should be working with that they can trust to help them navigate through the immigration system and the healthcare system in the United States. So Health Carousel is actually a leader in international recruitment, and we consider it important to make sure that our candidates and clients have the confidence in us that the manner in which that we're interacting with candidates is ethical, which can sometimes be a question from some of the candidates in various countries. So this recertification is a big deal. In addition, we recently were the first U.S. healthcare staffing company to be certified through an international organization called the Slave-Free Alliance. We also have significant partnerships with third parties, such as the Joint Commission and others. We're tremendously proud of the work that we do, and as part of our mission to improve lives, it's important that we ensure we are operating under the utmost practices. And so the recertification, along with several of the other things that we do, these aren't required for us to operate in this business, but we view them as necessary in order to make sure we can signal to our candidates and our clients the manner in which we do business.
Certainly can understand why that means so much, and thanks for getting into some of the details there. Now, looking ahead, what's next for Health Carousel? Anything we should be aware of?
Yeah, sure. I think, I mentioned the pandemic before. The biggest thing that changed is nurses, through the last couple of years. The other thing that happened, nurses, as well as several other professionals like teachers and others, really saw a much higher level of burnout. And what nurses are now needing and demanding is more flexibility in order for them to balance the very challenging career that nursing is with their mental health and their life. And so what we see on the horizon is more and more nurses making the choice to have a career that is based on working on more of a temporary basis at various hospitals throughout the United States, as opposed to the traditional approach, which was a nurse taking long-term employment at a single hospital. So what we foresee in the future is more and more nurses interested in the kind of work that Health Carousel does, where we typically operate domestically with nurses on 3 to 6 month contracts at various facilities. The nurses usually have the opportunity to extend their assignment at those facilities if they're interested and if there continues to be needs. And it allows the nurses to have a long career in nursing, but also having the flexibility that they need. And this is vitally important because another thing that came out of the pandemic is something like 25% of nurses saying that they plan to leave the profession. And because of the critical shortage that we're going to have in nursing, we can't allow that to happen. We have to find ways to allow more nurses to stay at the bedside for longer. And so we believe the combination of the traditional model of nurses working full-time at hospitals and other locations, combined with increasing numbers participating in a career on a more temporary basis, will allow more nurses to stay by the bedside and allow Health Carousel to enable more patients to have healthcare professionals when and where they need it.
Well, that certainly is some eye-opening information there as we conclude today. And again, it just shows you how important your efforts are through Health Carousel in the healthcare space, and really do appreciate your joining us here today to introduce the company to us. If you would tell us and tell our listeners where they could find more information online on Health Carousel and a way to be in touch as well.
Yeah, thanks a lot, Eric. Please come and visit healthcarousel.com. That's Health Carousel is CAROUSEL.com. If you're a healthcare professional, there's a place that you can click to learn more about how you can work with Health Carousel as a healthcare professional. If you're a hospital client that's looking for help in solving your nursing shortage on a temporary or long-term basis, there's an area for you to click there as well. And we'd welcome all of your listeners to come and visit our page, learn more about our company, and to support us in our mission to improve lives and make healthcare work better.
Again, we appreciate all you're doing. Again, folks, it is healthcarousel.com. Of course, this link will be included within the show notes of this broadcast. Mr. Sebastian, all the best, and thanks for joining us here today on the Health Radio.
All right. Thank you, Eric. Bye-bye.
Again, we've been speaking with Mr. John Sebastian, the CEO of Health Carousel, one of the largest and fastest growing healthcare staffing and workforce management solutions in the U.S. And again, for all the details, visit healthcarousel.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the Health Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.